Hello everyone. Today we will learn about obstructive airway disease. By the end of this video, you'll have a solid understanding of what are OAD and its definitions. Obstructive airway disease, commonly referred to as OAD, is a term used to describe a group of chronic respiratory conditions characterized by airflow obstruction or limitation, which leads to difficulty in breathing. The primary types of OAD are chronic obstructive pulmonary disease, asthma, bronchiectasis, and bronchiolitis obliterans. Each of these diseases has its unique features and symptoms, but they all fall under the umbrella of obstructive airway diseases due to their common characteristic of obstructing the airway, which leads to the difficulty in breathing. The Global Initiative for Chronic Obstructive Lung Disease, or GOLD, defines chronic obstructive pulmonary disease as a heterogeneous lung condition characterized by chronic respiratory symptoms, such as dyspnea, cough, expectoration, and exacerbations due to abnormalities of the airway and/or alveoli that cause persistent and often progressive airflow obstruction. Basically, there are two main abnormalities. Abnormality of the airway causes chronic bronchitis, and abnormalities of alveoli causes emphysema. Let's understand these two entities of COPD. Classically, chronic bronchitis is defined as a persistent cough for at least 3 months in each of 2 successive years in a patient in whom other causes of chronic cough have been ruled out. The alveolar disease emphysema is described as the enlargement and destruction of the air spaces distal to the terminal bronchioles. Now, let's see the definition of other common OADs. Asthma. The Global Initiative for Asthma, GINA, gives the following definition of asthma. Asthma is a heterogeneous disease, usually characterized by chronic airway inflammation. It is defined by the history of respiratory symptoms such as wheeze, shortness of breath, chest tightness, and cough that vary over time and in intensity, together with variable expiratory airflow limitation. Bronchiectasis. Bronchiectasis is defined as a chronic lung disease characterized by abnormal permanent enlargement of part of bronchial airways and weakening of the mucociliary transport mechanism, leading to mucus pooling throughout the bronchial tree. Bronchiolitis. Obliterans, also known as constrictive bronchiolitis, is a type of obstructive lung disease of the small airways characterized by fibrosis of terminal and distal bronchioles. With this knowledge, we can better approach treatment and management strategies, ultimately improving the quality of life for those affected by obstructive airway disease. In the upcoming videos, we will learn more about these diseases one by one. Do subscribe for more videos.